The elimination of factors of any type that provoke allergic reactions in asthma is the basis that will ensure, if not quite healthy, then a fairly tolerable existence for such a person. This does not mean at all that he refuses earthly pleasures, but he must observe certain specific restrictions in food and simply in living conditions. If a person, for example, is not inclined to eat seafood, then such a restriction will not bother him much. But the reduction in the consumption of bakery and dairy products can already cause inconvenience to any person. At the same time, a moderate intake of salt and sugar, which is also indicated for patients with asthmatic syndrome, is also recommended for a completely healthy individual. After all, excessive consumption of these products can contribute to the development of other, no less serious diseases, such as diabetes and various types of autoimmune syndromes. Except the foods listed above, you should also limit your intake of the following foods: legumes, nuts, smoked meats, chocolate, fatty meats, sauces based on tomatoes. This also includes a number of fruits: currants, peaches, strawberries, raspberries, and citrus fruits. Honey and eggs are also not recommended, and, as with a number of other diseases, alcohol should be consumed in moderation. From the list of nutritional recommendations, you need to pay special attention to two things: eating steamed food and the frequency of eating it 4 to 5 times a day. Actually, the last advice is not much different from the modern recommendations of nutritionists, and it is not at all difficult and even useful to follow. It is much more difficult to follow the dietary recommendations above, and from the recommended products, a variety of cereals, which over time and increasing age gradually enter our diet, fruit salads and low-fat rich soups, the same low-fat meats and bran bread, various types of oatmeal and other dry cookies. But the rationalization of nutrition is not all to alleviate an asthmatic person his or her suffering. There are a number of specific non-drug recommendations that can significantly improve the patient's condition. In addition to the special diet mentioned above, these are speleotherapy, a method of treatment when a person is in a room with an organized karst cave microclimate, and halotherapy, salt air treatment. As scientists have found, exposure to the salt factor by inhalation, not consumption, can greatly prolong the time of remission, in general, contributes to respiratory tract recovery. It should be noted that since asthma is common among a wide, very diverse population in the world, not all of them have the opportunity to access drug treatment methods that have been mastered, certified, and recommended by modern medicine. For various types of asthma, non-traditional treatments have also entered our lives, which have not passed clinical and other medical scientific tests adopted in the modern civilized community. A number of them are at the stage of scientific study. Others are still out of sight of modern medicine. Here are some of them, but we immediately note that in any case, the option of using this method of treatment still involves taking into account the opinion of the relevant narrow specialist, since it is unacceptable to experiment with such a sensitive area of our being as health. Sometimes, due to lack of funds, a person does not inhale, for example, karst caves air, but simply buys a salt lamp in a store and uses it similarly for deep inhalation of salt air. According to a certain scheme, a decoction of ginger root is used. It is taken 100 milliliters before meals in a heated form. But the most proven non-traditional method of treatment was proposed by Dr. Batmangalij. Melted or salted water in a certain way is taken according to the indicated scheme before and after meals. But again, it is worth emphasizing that even the most advanced and proven effective method of non-traditional treatment has not yet become one of the unequivocally recommended by modern medical science. It has already been mentioned above that asthma is not an acute but a chronic disease and often occurs in childhood, often associated with the consumption of food allergens. The contact of the child's body with provoking agents that can cause an atypical, increased reaction is called the atopic form of the disease. The provoking agent in such cases is a substance of a protein nature that enters the baby's body along with food. Since this disease in childhood is genetically determined, its development can be influenced by the mother's smoking during pregnancy or simply by poor heredity. If, for example, only the mother of a child suffers from asthma, then, according to statistics, the risk of getting sick increases 2.5 times in a newborn. If both parents are sick, 6.5 times. However, not only poor heredity carries increased risk of disease in infancy, a child can acquire asthma even after birth. The unfavorable ecological environment, frequent colds at an early age, advanced atopic dermatitis, and simply passive smoking in the presence of a child have a pathological influence on the compromised yet not strengthened immunity of a young organism. Besides, one of the reasons for the development of asthma in childhood is a mental factor. If the mother does not pay enough attention to her child at an early age, the latter may develop such a syndrome. However, this phenomenon is still under scientific study. Diagnosing a disease in a child is more difficult than in an adult, and this is one of the factors in possible advancement of the disease from an early age. Not only is asthma similar in its symptoms to acute respiratory diseases, swelling of the mucous membrane, thick sputum. In an adult, this is already a syndrome of suffocation or bronchospasm. But there is also the fact that the baby, due to its age, cannot correctly describe what it feels during an attack. That is why modern medicine has special diagnostic methods to detect asthma in a child. These include keeping a medical history of the parents of a newborn who exhibits warning signs. An in-depth analysis of symptoms is carried out so as not to confuse a possibly developing disease with common respiratory diseases. Treatment is carried out in a test mode for 1 to 2 months, with an attempt to determine whether an improvement in the health condition occurs after the use of specific drugs. If reasonable suspicion arises, move to the level of in-depth laboratory testing. And only with a confirmed disease, a chronic form is diagnosed and complex treatment is started. This, in general, boils down to the above 2 methods, medication and preventive forms. In this part, the treatment of an adult and a child is not much different. Is it possible to prevent the onset of asthma, and what is necessary for this? First of all, in children with a hereditary predisposition to allergic reactions, it is necessary to keep breastfeeding as long as possible. This will support the vital activity of the necessary microorganisms in the intestines and strengthen the baby's immune system. At an older age, prevention of the development of bronchial asthma is reduced to the exclusion of contact with provoking factors, such as dust, tobacco smoke, animal hair, pollen, chemicals, which is the main cause of the disease. This involves creating an ecologically clean environment for yourself and your children. Asthma has not bypassed many prominent people, both from the past and our contemporaries. However, they were able to overcome all the difficulties on their life path, overcame themselves, and reached significant heights. Napoleon Bonaparte and Peter I the Great suffered from asthma, but reached the top in statesmanship, became famous war chiefs, etched their names into history in this field. American presidents Theodore Roosevelt, John F. Kennedy, and Bill Clinton are also asthmatics. Theodore Roosevelt treated his asthma only with herbal tea, and along the way, he also suffered from malaria. Kennedy's disease was provoked by hair. Another well-known politician, Cuban revolutionary Ernesto Che Guevara, hero of 3 revolutions, was eventually executed, but his greatest fear was to be left without anti-asthma medication. World prose masters Marcel Proust, Charles Dickens, and Konstantin Pastovsky were also affected by this disease. Dickens tried to fight it with opium, as was common at that time. Pastovsky relieved the attacks with the help of a hydroionizer, to which he adapted a folded newspaper. He once said, "Asthma is a relentless disease that causes a person to breathe in a quarter of a breath." Famous asthmatics also include actresses Elizabeth Taylor, Sharon Stone, singer Liza Minnelli, film director Andrei Tarkovsky, as well as world-class athletes, Norwegians Ole Bjorndalen and Marit Bjorgen, Englishman David Beckham, and Ethiopian Haile Gebrselassie. Ludwig von Beethoven, the famous German composer and conductor, suffering from asthma, gained worldwide fame, even though he became completely deaf by the age of 49. There is a well-known saying of him, "Music should strike fire from the heart of a man."